Hi everyone, welcome back to your channel. I love pharmacology. In this session, let us learn about a very important topic, that is calcium channel blockers. Myself, Dr. Padmanabha, TS, Faculty of Pharmacology. So, welcome you all to this session on calcium channel blocker. So, before going to their mechanism of action, let us understand where they are used mainly. So, this calcium channel blocker, they can be used in the treatment of migraine prophylaxis, Raynaud's phenomenon where there will be peripheral vasoconstriction, and this calcium channel blocker will going to cause vasodilation. So by doing vasodilation, they are going to give a relief in case of the Raynaud's phenomenon. And they are also used for relaxation of the uterine smooth muscles where you can delay the preterm labor. So it can be used in migraine prophylaxis, Raynaud's phenomenon, as well as preterm labor. Thereby you can delay the preterm labor by relaxing the uterine smooth muscles. So what are the types of calcium channel blockers you know? So let us understand there are two types of calcium channel blocker. One among them is the dihydropyridine and second group will be the non-dihydropyridines. So usually these dihydropyridines will end up with the depin. So the examples are amlodipine, nicardipine, nifedipine, felodipine and the clevidipine. So all these dihydropyridines, they end with depin. So D for depin. So the main mechanism of action of dihydropyridine is to dilate. It causes depin dilate. So it causes dilatation of the blood vessels. So it has got potent action on the blood vessels. It has got potent action on the blood vessels. So thereby it causes the vasodilation. So basically it will going to block the calcium entry into the vascular endothelial cells. Thereby it will going to decrease the contraction of the vascular smooth muscles. So what will happen whenever there is a decrease in the calcium entry? So there will be relaxation of the vascular smooth muscles which lead to the vasodilation. So depin dilate you should remember. So whenever there is a vasodilation, so predominantly there will be vasodilation when compared to the suppression of the cardiac contraction. So what happens is here the depins predominantly act on blood vessels. They also act on the heart, but predominant action is on the blood vessels. So since it causes vasodilation, they can be used in the treatment of hypertension. And one more thing you should remember is the nimodipine. So nimodipine has got the special indication which you should not forget at all. So again they end with depin. So what is the mechanism of action of depin? All the depins will going to cause vasodilation. The unique feature of this nimodipine is it crosses the blood-brain barrier. It crosses the blood-brain barrier. In the blood-brain barrier, once it crosses the blood-brain barrier, it will going to cause the cerebral vasodilation. In the cerebral, there are blood vessels which will going to respond to the nimodipine. So basically where it can be used? It can be used to overcome the cerebral vasospasm. So you can prevent the cerebral vasospasm or you can treat the cerebral vasospasm due to the aneurysmal subarachnoid hemorrhage. So where do we use nimodipine? Nimodipine is used in the treatment or prevention of the cerebral vasospasm which is occurring following the aneurysmal subarachnoid hemorrhage. So at least you should remember nimodipine is used in the subarachnoid hemorrhage. The reason being or the rationale is to overcome the cerebral vasospasm because it dilates the vascular smooth muscles. It will going to relax the vascular smooth muscles, thereby it dilates the cerebral blood vessels. So Nemo navigates through the blood vessel. So next coming to the non-dihydropyridines. So this is also very important. So here among non-dihydropyridines you need to remember are two drugs. One is the verapamil and second one is the diltiazem. So these both drugs will also act on the cardiac muscles as well as the vascular smooth muscles. Here, the action of these non-dihydropyridines are predominant on the cardiac smooth muscles when compared to the blood vessels. But whereas in case of the dihydropyridines, the predominant action was on the vascular smooth muscles when compared to the cardiac muscles. So this difference you need to remember. So verapamil diltiazem belongs to non-dihydropyridines. They act predominantly on the cardiac smooth muscles when compared to the blood vessels. Let us understand the individual drugs now. Verapamil. Verapamil V4, it has got very selective action. Very selective action. You can remember it as very selective action on the cardiac smooth muscles. So especially they are very selective towards the cardiac calcium channels. Thereby, once you block the cardiac calcium channel, it depresses the heart, it decreases the contraction, it decreases the oxygen consumption, it decreases the workload. Thereby, it decreases the oxygen consumption. And also on the other hand, since it causes the vasodilation of the coronary blood vessels, it also increases the oxygen supply to the heart. So where it can be utilized, they can be utilized in the treatment of angina as well as in case of the arrhythmia. In angina, because of the vasodilation, there is a more blood supply as well as the oxygen supply will be there. In arrhythmia, since verapamil will going to depress the sinoatrial as well as the AV conduction node, it will going to reduce the impulse generation as well as the conductance. So on the other hand, we have a diltiazem. So diltiazem, you can remember D4, it has got dual action. It has got dual action. It has got dual action. It also acts on both heart as well as the vascular smooth muscles. So it is going to block the cardiac as well as vascular calcium channels. So where it can be used, since they are very effective on the calcium channels of vascular smooth muscles as well as the cardiac smooth muscles. So if it blocks the calcium channel, the cardiac system or cardiac muscle, they are useful in treatment of arrhythmias. If they block the calcium channel in the vascular smooth muscles, they are effective in the treatment of the hypertension. Is that clear? Fine. Next, moving on to the mechanism of action in general about the calcium channel blocker. So this is the membrane and this is the voltage gated calcium channel. So this is the voltage gated calcium channel and this is the calcium and this is the calcium channel blocker. Once you give the calcium channel blockers, it will going to come and attach to the voltage gated calcium channel which is present in the vascular smooth muscles as well as the cardiac smooth muscles. So the entry of calcium will be blocked. Entry of calcium will be blocked. Thereby, it decreases the entry of the calcium into the cells. So once there is a decrease in the entry of calcium into the cells, what happens to the contraction and the conductance? It will going to reduce. It will going to reduce. So let us take individual examples. So whenever the calcium acts in the cardiac smooth muscle as well as the vascular smooth muscles, the end results will be the contraction. End results will be the contraction of the vascular smooth muscles as well as the cardiac smooth muscles. So now in case of whenever you give a calcium channel blocker, what happens to the calcium entry into the smooth muscles? The calcium entry will be reduced. So what happens is here the cardiac contractility will be reduced as well as here due to the vascular smooth muscle relaxation, it will going to cause the vasodilation and it will going to depress the cardiac conductance as well as the cardiac workload. So this is the main effect of the calcium channel blocker, where it will going to cause contraction of the smooth muscles present in the, it will going to reduces the contraction. That means it will going to relax the cardiac smooth muscle as well as the vascular smooth muscles. So whenever you give a calcium channel blocker, so what happens with respect to the blood vessels? It will going to cause vasodilation. So once there is a vasodilation, what are the beneficial effect you will going to notice? So there will be reduction in the blood pressure. It is BP, reduction in the blood pressure. Thereby, in turn, there will be reduction in the peripheral vascular resistance, and also it reduces the after load. It is the pressure which will be able to force the blood against the force of contraction. So after load is the one which will going to be helpful in case of the ejection of the blood from the heart. So this will be happening at the force which will be high. So whenever the force required is, the pressure required is very high, there's a less chance of blood which will be moving on to the peripheral system. So basically by vasodilating the blood vessels, it will going to cause decrease in the blood pressure, decrease in the peripheral vascular resistance, as well as decrease in the after load. Basically the vasodilation will occur mainly in the arterioles. Please remember, mainly in the arterioles. And next is on the cardiac system. Since it causes coronary vasodilation, it will going to improve the oxygen delivery. It will going to improve the oxygen delivery into the heart. And also simultaneously it will going to decrease the force of contraction on the heart, thereby it decrease the oxygen demand or oxygen required for the cardiac functioning. Apart from that, these calcium channel blockers will also reduce the contraction or reduce the mechanism of impulse generation as well as conduction, which are produced by the SA node as well as the AV node. So basically the calcium channel blocker here, they are going to prevent the depolarization of the cardiac pacemaker cells. So whenever there is a prevention of the depolarization of the cardiac pacemaker cells, the activity of the SA node and AV node will be reduced. So in turn, what it will do is, once the activity of SA node and AV node is reduced, there will be decreased firing, there will be decreased impulse generation, there will be decreased impulse conduction, which in turn finally leads to decrease in the heart rate. So thereby it can be used effectively in the treatment of arrhythmias. So next, coming to the side effects profile. So dihydropyridines, as you know, dihydropyridines are the most potent vasodilators. So whenever there is a vasodilation, what happens? There will be blood vessels will be dilated and there will be more blood supply. There is a peripheral pooling which will cause headache, dizziness, skin flushing will be there because of the excess of blood supply. There can be peripheral edema and also the hypotension. Because of the hypotension, the body will respond in such a way that there will be reflex tachycardia, and reflex tachycardia will occur mainly to meet the adequate tissue perfusion. Apart from that, one should remember that this calcium channel blocker can also cause gingival hyperplasia. So which is the one more drug which is more commonly known to cause gingival hyperplasia with respect to the anti-epileptic drug? So can you guess which is the anti-epileptic drug which can cause gingival hyperplasia? Yes, it is your phenytoin. So main side effect of dihydropyridine is vasodilation, hypotension, reflex tachycardia. So coming to the non-dihydropyridines has got both effect on the vascular smooth muscles in the vascular smooth muscles as well as cardiac smooth muscles. So vasodilation, it has got similar side effects such as that of the dihydropyridines, that is the hypotension, headache, dizziness, etc. Whereas here, due to the contractility, so it reduces the contractile, thereby it causes is bradycardia. It can cause constipation, it can cause hyperprolactinemia. So coming to the special features of non-dihydropyridines. So non-dihydropyridines are the one you should be very careful about. So since it causes bradycardia as well as the constipation and hyperprolactinemia, you should be very, very careful because these drug can cause drug interaction. So because of this reason, non-dihydropyridines are contraindicated if the patient is having already bradycardia, because it will going to cause bradycardia. There will be exaggerated fall in the heart rate and patient may die also. And this should not be given in case of the heart block, because if you are decreasing the heart rate, what will happen to the patient? Patient will collapse. It should also be not used in the heart failure also. And these contraindications are absolutely for non-dihydropyridines, but some are the lesser extent. Even dihydropyridines group of drug should be avoided in such individuals having bradycardia, heart block as well as the heart failure. So coming to the summary, so calcium channel blocker has got two class of drugs, that is the dihydropyridines and non-dihydropyridines. All the dihydropyridines will end up with depin, amlodipine, nimodipine, clevidepin, etc. Depin, D for D. D, it causes dilatation. So dihydropyridines are mainly acts on the vascular smooth muscle, thereby it causes vasodilation. So more common side effect will be the hypotension and reflex tachycardia. One of the main thing you should remember of a nimodipine is used in the prevention as well as treatment of the vasospasm, cerebral vasospasm due to the subarachnoid hemorrhages, because it crosses the blood-brain barrier. On the other hand, we have a non-dihydropyridines. Example is verapamil and diltiazem. Whereas the verapamil has got selectively cardiac calcium channel blocker, whereas the diltiazem has got both action on the cardiac as well as the vascular smooth muscles. So since it causes the action of vascular smooth muscles will be vasodilation, they can be used in case of hypertension. Whereas since it reduces the cardiac conduction, it can be used in the case of the arrhythmias. The side effect profile mainly it is vasodilation, it causes hypotension. Apart from that, non-dihydropyridines, it reduces the SA nodal activity, thereby it reduces the conduction, thereby main side effect will be it causes bradycardia. Apart from that, it also causes constipation and hyperprolactinemia. So to contraindications for the use of non-dihydropyridines, and to the lesser extent, the dihydropyridines should be avoided if a patient is having any bradycardia or heart block or a heart failure. So this was about the simple class on the calcium channel blocker. This will going to help you in terms of understanding the calcium channel blocker, the mechanism of action, their uses, as well as the side effect and the contraindications. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, for more updates on interesting topics. Thank you.